All right, to the United Kingdom now, where the first human trials was launched by the Oxford University to test a COVID-19 vaccine. Joining us live from London is Mika Manyalak. Hello, Mika.
Hi, Alma.
Hi, how are you doing?
I'm good, thank you.
All right. Okay, go ahead.
So, with remedy to this pandemic, Oxford University here in the United Kingdom is starting a human clinical trials for a vaccine against the new coronavirus, with the ambitious hope of making it available to the public this year. In its first phase, half of 1,112 volunteers will receive the potential vaccine against COVID-19. The other half a control vaccine to test its safety and efficacy. We gain more insight with the director of the vaccine group of Oxford University, Professor Andrew Pollard, and 2 trial volunteers.
So there's a huge responsibility always in conducting clinical trials, but actually the key question is to make sure we have the integrity of these clinical studies to answer the question so that if the vaccine does work, that we can be confident in that result, and that will then lead to further development and hopefully deployment of the vaccine. And if it doesn't work, or there's a safety question, that we can generate those data from the trials that we're running. So at the moment, we have very small-scale manufacturing for clinical trials, and there's a big technical challenge to upscale from that to give very large numbers of doses. And particularly when you think that if you were looking at a domestic requirement, there'd be millions of doses, tens of millions of doses, but actually this is a global problem, and we need hundreds of millions or billions of doses of vaccine.
Well, I'm a scientist, so of course I want to try and support science, the scientific process whenever I can. And since I don't study viruses, I felt a bit useless these days, so I felt like this is a very easy way for me to support the cause. Yeah, that's why I'm here, and I'm excited.
It seems like the right thing to do to ensure that we can, combat this disease and get over it a lot faster. I think you can never fully exclude any sort of potential risk, but I think you have to, walk in faith in these things. You have to trust in that the work has been done as best they can, and know that the cause is important. And so you just have to just walk in faith in that.
With continuous positivity of the more than 100 research projects around the world to find a vaccine, this is described by the United Nations as the only route back to normality. 7 are currently in clinical trials, according to the London School of Hygiene and Tropical Medicine. Such trials are already underway in China and the United States, and with Germany to begin at the end of this month, where the Federal Vaccine Authority gave the green light on Wednesday. Health Minister Matt Hancock said the British government strongly supports Oxford University's work, and the first human trials were to start on Thursday. He hailed the promising development, pointing out that it would normally take years to reach such a stage of vaccine development. The volunteers are aged between 18 and 55, are in good health, have not tested positive for COVID-19, and are not pregnant or breastfeeding. 10 participants will receive 2 doses of the experimental vaccine, 4 weeks apart. Back to you, Alma.
Did the scientists in Oxford University say how this vaccine works?
Yes, Alma. So the vaccine is made from a weakened version of a common cold virus known as adenovirus. This has been taken from chimpanzees and has been modified so that it cannot grow in humans. The adenovirus vaccine is known to develop a strong immune response just with a single dose and is not a replicating virus. So therefore, it cannot cause infection, taking into account that this will make it safer for children, the elderly, and patients with underlying diseases such as diabetes. So how it works is scientists have taken the genes from the spike protein of the surface of the coronavirus and put them into the harmless virus, adenovirus, to make the vaccine.
Okay.
This is then injected into the patient. The vaccine then enters the cell and starts producing the coronavirus spike protein. This will in turn prompt the immune system to produce antibodies and activate killer T cells to destroy the infected cells. Of course, the trial volunteers will be carefully monitored in the coming months. They have been told that they may have a sore arm or headaches or fevers, as it is common to have side effects with any medication in the first couple of days after vaccination. But scientists hope that to have 1 million doses ready for September, and to dramatically scale up the manufacturing after that, should the vaccine prove effective.
All right. We'll watch out for that development. Thank you very much, Mika, and stay safe always. Stay healthy. Thank you for your time.
Thank you, Arima. Reporting from London, United Kingdom, this is Micah Manialak, and we live in interesting times.